In today's video, we're going to be talking about bed sores, which are also known as pressure ulcers. Bed sores are problems in which long-term care facilities or hospitals take care of patients who have limited mobility and they need that special care because they are not able to move around as much as someone who is a very active individual. So bed sores are caused by individuals like laying on a surface in one spot, so they don't move a lot. So the pressure of your skin and that surface that the individual is laying on will cause the blood flow to be abnormal due to that limited movement of the patient. So when blood flow is decreased in the dermal tissue, the cells will die and the blood will not be able to transfer to the epidermis, and that epidermis needs that blood. So in this case, you have low to no blood supply, which kills the dermis, and that will affect the basal keratinocytes. So it does not bleed because, as I stated before, it's going to cut off that supply. You're not going to have any blood supply. So bed sores have an unusual color to the skin, and they are probably going to feel either hard or squishy, and they can even look like a bruise, but a worse bruise, and that's how you're going to know, and it's going to indicate that you have some kind of damage under the skin. So a healthcare worker who's trying to prevent these bed sores will probably make sure that the patient is moving very frequently, and that will help to reduce that risk of these pressure ulcers, as well as making sure that their patient is hydrated. Hydration is very important to maintain and support the body's blood flow for any damaged tissue. And moving the patient will not only help the development of bed sores, but it will also help because we do not want that tissue to build up and cause our blood flow to be cut off. So in this case of bed sores already doing damage to prevent any excess harm to the body, you would just want to remove the pressure and the dead tissue.